We are back here with Tuesday Tips. We try to meet every Tuesday afternoon to discuss different topics of plastic surgery, and I get to answer your questions. So thank you so much for joining, for seeing the videos. And today we're going to talk about a topic that someone asked me last week, that if I could talk a little bit more about this. So of course, let's talk about round 2 BBLs. I've talked about BBLs a bunch of times, and you've probably seen all my videos about ultrasound guided BBLs. What is it? The recovery, the fajas, the massages. But what makes a round 2 different than a round 1? Or a very common question is, why get a round 2? You know, a lot of patients are like, I just wanted to get one and done. Why on earth would someone want to do this twice? Well, usually it's not that they want to do it twice from the beginning, but there are some limitations that a round 1 or just one surgery can do depending on your foundation and your goals, okay? So usually the person that comes for a round 2 wasn't thinking that they wanted to do 2 rounds from the beginning, but seeing their results and discussing their goals with their surgeon, they got to the end of understanding that they really wanted to try a round 2 for several things, and I'll go over that, right? So what are the common reasons someone comes back for a round 2? Number 1, and the most common one, is hip dips. So let's talk a little bit about hip dips. What is hip dips? Hip dips is what's called the trochanteric depression. It is an anatomical area that we all have. Some people have it a little bit more depressed, some people have it less, but everyone has what it's called a hip dip. And hip dip is just the skin in that area comes more attached or more closer to the hip bone and the ligament. So it's an area that it's poorly vascularized. The areas of our body that are around the joints and ligaments don't have a lot of blood supply. The muscle has more blood supply. The fat goes second, and the least blood supply areas, talking about different anatomical regions, is usually the bone and ligaments, okay? So areas, when we're transferring fat to areas with less blood supply, the fat has less ability to survive there. Let's talk a little bit about that, right? A BBL is moving fat from one area of the body to the other, and that's why it's called a transfer and not a transplant, okay? When we're transplanting something, right? Oh, but we put a kidney from someone in another person and the kidney survives. Why, if I just move fat, it doesn't survive in my own body? That's the difference between a transfer and a transplant. When we're moving a transplant, an organ, you're reconnecting the blood supply of that organ. For example, if you're moving a kidney, you take the kidney with the artery and vein and you put it back there, and you literally saw the artery to an artery of that other person, so the blood supply is instant. That new organ has blood supply instantly and it survives, right? The fat is different because the fat, I'm suctioning it, and the particles of fat, I'm transferring it, but I am not connecting any artery and vein to it. Your body, or our bodies, need to basically build those blood vessels to nurture or supply that new fat cells for them to survive. So it's a process, okay? It does not happen overnight, and it takes time. And usually that fat that I moved, approximately 20 to 30% does not survive. So we lose 20 to 30%, or set it the other way around, 70 to 80% survives, okay? You've heard about me talking about 7 to 80%. Well, the opposite is true as well. 20 to 30% does not survive. So areas with more blood supply, like the buttock, then the survival rate of the fat is higher. Areas of the body with less blood supply, like the hip dips, that area, the fat stays less, okay? So in this patient, let me show you a different view. This patient, one of her concerns was the hip dips. The hip dips, or trochanteric depression, you can see it here and here, right? It's where that bone is more superficial, and it's basically skin and ligament. There is very little subcutaneous fat in that area, okay? So after one round, we were able to round a lot of that. You see this here, very marked. She was able to round a lot of that and get that hourglass figure. She was super happy with her round 1 results, but she still has a little bit of that depression that bothered her. She was looking to get that perfect roundness, okay? That's why she considered the round 2. Again, very happy with one round, and a lot of people are like, I don't want to go for a second one. I'm happy with those results, and that's fine too, right? Our goals and expectations are very different, and that's okay, and that's good to recognize. And she came back for a second round. The other reason why a lot of people come is because of projection. So projection, or how much the buttock comes out, or when you're in a side view, you can see that projection, right? So she wanted more projection, and she was able to get a lot of projection, but she wanted a little bit more in this area here to get more roundness, okay? Why can't we achieve that projection in one round? So when I'm injecting the fat, the skin needs to stretch, and the skin has a limit of how much it can stretch instantly, right? And some people say, well, in pregnancy, it fits a baby. The skin stretches. Why can't you just inject more fat and the skin stretches? Well, the pregnancy takes 9 months for that skin to stretch to that limit. I am not injecting fat for 9 months. I'm injecting fat for 20, 30 minutes in the operating room, right? So there's a limit of how much that distension or extension of the skin can make, okay? And some people say just inject more, just like stuff it there. One, if I try to put it more, sometimes the fat even starts to come out, like there's no room for more fat. Two, if the skin doesn't start to round up more, what's it gonna do? There's a limit here. It'll start to come up and down to give a very square buttock instead of that good transition. So the limits of how much fat that I inject is, one, I'm looking for a shape, right? I'm not gonna inject for give you more volume, but compromising the shape, which is the most important thing after a BBL, getting you that shape. And the other important thing to consider is, remember I talk about fat survival. The fat needs blood vessels and it needs space. If you put a lot of fat in there, you're actually putting tension on the little capillary blood vessels, which is gonna cause that less fat survives. It is too much, it's too crowded, and the blood vessels don't have room to get to that new fat. So the more you put and the more tense it gets, it actually, then more fat dies, because it's just too much of the fats for the blood supply that it has, and it's compressing on that blood supply, so it's less. So the projection that we can achieve with one round, it's limited by the skin elasticity and also by the patient. And the other reason, the other reason is the shape, right? The other main reason is I want more people that want more of a vixen look, or very dramatic high hips, very thin waist, very large hips. Those usually need 2 or 3 rounds to get you there because of that stretching of the skin serially, okay? Once we stretch it a little, then we can go with the second round and stretch it more and off, okay? So you can see with this is round 1. She was able to achieve a lot of projection, but those 2 things, right? She was looking for a little bit more roundness here and getting those hip dips filled, okay? So she came for a second round. The second round was 1.5 years after her first round. And you can see with this second round how we could achieve more projection, especially up here, to get that more like a bubble butt or more round shape of the buttock. And then on the, we had
play. Let me help you.
play.
Okay.
But I don't have the posterior view.
No, didn't get it.
No? Okay, we don't have it. But trust me, the hip dips were filled. I thought I had it, but the hip dips were filled with that second round, okay? Actually, if you go to my Instagram, you can look for her before and after of that second round, and that posterior view is there. So if you want to go in my page, scroll down a little bit, and you can see that the hip dips were completely round up, and she's super happy with that second round. But what are the limitations? Yes.
Can I go there and
course.
find it for our
technical difficulties, and my tech support is coming to help.
Okay.
So
well, here is.
yes.
You're
so
still live here.
I am. Okay. So what are the limitations? Limitations of the second round is number one, and most importantly, how much fat you have available. So if your BMI wasn't too high and we did a round one and removed all that fat from the torso, then for round two to achieve more projection, the limit is going to be how much fat we have left. Usually in round twos, I encourage the patients to consider other areas that weren't included in the liposuction on the first BBL. For example, arms, inner thighs, to try to get more fat to achieve those results, okay? The other limitation is how much projection you want, right? Because with the second round, there is less fat available, and we can achieve some projection, but without much fat. And the skin elasticity, yes, the skin was already stretched, but there's again a limit that we can reach. If you want a very dramatic result, that's when you may need a third round. But the majority of my patients are very, very happy with the second round, and I haven't had any patients coming for a third round that I've done the first two. The other very common reason that I didn't put here, maybe with the shape part, is very common reason for getting a round two and more commonly nowadays, is actually for a reduction or reshaping of the first round of the BBL. So sometimes the round one has given patients a more, technical difficulties were corrected, and we have the posterior view of the round two. So you can see that those hips were completely filled in. Very good projection and roundness. This is an initial 5-day post-op, and this is 6 weeks post-op. You can see how she maintained that very round, no hip dips shape, okay? Going back to the reshaping, a lot of times it is not because of projection or because of the hip dips, it's more reshaping. Maybe that first round gave you a buttock that is too high for you, or the hips are too high, or there's a flat spot that you want to correct. So sometimes all of those things can be corrected with a round two, and it doesn't necessarily need to be because you want it to be bigger or rounder. It's just for areas that don't satisfy or are not in your favor, you don't like them, okay? I mentioned flat spots, and I can do an entire talk about flat spots, but areas that are flat or dimpled are very hard to treat sometimes because it's a combination maybe of bands of tissue like cellulite causing that dimpling. So if you don't cut those bands and release them, you can inject fat, but if that band of collagen is there holding it, you won't see that roundness. And there's a treatment called Avili that we have here at Pure. That Avili can be done in the clinic under local anesthesia, or it can be done in the operating room when combined with other procedures under general anesthesia, but it cannot be combined with a BBL at the same time. You need to stage it. Why? If you release that band and inject fat at the same time, that dimple that it was first like that, with that collagen band, you release it. If you fill it with fat, this skin that it's already stretched down may pop up with fat, and that's called a blowout deformity. So we need to have this released, this skin kind of settle back to its position, and then at least 3 to 4 months later, fill it with fat without that risk of blowout deformity. And the other way around is also okay. If you want to do the BBL, see what areas improve, because sometimes the dimpling is not because of cellulite, it's because of skin laxity causing those dimplings. So sometimes you can go with the BBL first, fill everything in. Afterwards, if you see any residual dimples, then those are cellulite, and we can go ahead and release it with the Avali. So that combination is very, very good, but not at the same time. Okay. Other flat spot areas that it's not related to Avali or cellulite, sorry. It's what we call skin memory. So just imagine that your skin has been flat in that spot since you were born, right? That skin was born like that. The fetus was developed, and the skin has been like that entire life. So you put fat and you're able to stretch it a little, but still there is some memory that skin was in that shape, okay? It's like a box, you open it, but you still see where the memory of those folds were, similar to that in the skin. So sometimes it takes more than one round of fat to kind of stretch that skin and take off that memory of flatness in that spot. It's not that the surgeon forgot to put enough fat in that area, or the surgeon didn't put enough. It's a combination of those bands, skin laxity, and skin memory that may contribute to those flat spots or shaping. So depending on what it is, a combination of maybe Avali and or a second round will help some of those patients. Okay, I'll take some questions now.
We have a lot.
I'm
Yes.
ready. I am ready.
We're ready to the first one. If you start working out to increase muscle in the butt, will the BBL fat go away?
So no, but you have to be careful with what type of workout. You mentioned muscle building. That's the good one, okay? So you have to focus on strengthening that muscle. To basically, if you strengthen that muscle, engorge that muscle, it's going to get more projection, because the muscle is underneath and you have the fat on top. So you strengthen that muscle and you'll see some increase in, not projection, but just shaping of the buttock, okay? But if you focus your workouts in more like cardio type of workouts, burning fat, then yes, you may lose weight and lose the fat in the BBL.
I'm scheduled for around 2 in December. When can I have a virtual video consult with you?
Whenever you like. So easiest way, just contact your coordinator through Clara or give us a call and she can help you schedule it before the surgery.
Okay. How do you know which of the two it is? Cellulite or skin memory?
So if it's skin memory and cellulite, so skin memory is a more flat, the cellulite is more like dimples, okay? But between cellulite and skin laxity, you can pull the skin up. If the dimple goes away, then that's skin laxity. If you pull the skin up and the dimple is still there, that's cellulite.
If I get a BBL, are you able to fix my dog ears?
So if you had a tummy tuck and you have some excess skin in the corners, of course, we can definitely do that at the time of the BBL.
Okay. Also, we can fix your real ears too.
Not dog.
No,
real person
real
ears. Okay, yeah.
Dog? Question from our stories. Is it normal to feel a bruise, like feeling but not bruised after a BBL, like a bruise underneath skin?
Hard to tell. The easiest, just send us a picture to see what area is of concern. If you feel like an irregularity on the skin when you're palpating it, it may be swelling, it may be some scar tissue, depending on if you had other procedures done before. Sometimes patients that had a tummy tuck and then liposuction may feel areas of scar underneath, and with massages that improves a lot. But definitely send us a picture and we can tell you with more certainty.
Let's go to the next one. When can I resume working out after a BBL?
Working out at least 6 weeks, okay? So at 6 weeks after the BBL, you may start working out. That's when you can also start sitting down and applying pressure to the buttock and hip area. And like I mentioned earlier in the previous questions, it's important to focus on strengthening the muscles, HIIT type of exercises, weight training, rather than cardio burning fat exercises.
Should I get to my goal weight before round 2?
Yes, but if you are very skinny and you don't have a lot of fat, I may ask you to gain weight before the surgery to have enough fat to transfer. And if I ask you to gain weight, you'll need to keep that weight, okay? If you patients are like, okay, I can gain 10 pounds and then I'll lose it after the surgery. Remember that fat is the one that I transferred to the buttock. If you then go ahead and lose the fat afterwards, you're gonna lose the fat in the butt, okay? So you have to be comfortable with gaining, I'm not talking about, 40 pounds, I'm talking about 10 pounds, depending on the case, but that weight that you gain, you have to be comfortable with it and maintaining it so you can maintain your results. Okay, you guys, thank you so much for all the questions, for joining. Willie's dancing behind the phones. I'll see you guys next week on Tuesday Tips. Take care.